Mon invité aujourd'hui, le professeur Arnon Afek, bonjour.
Bonjour.
Vous êtes directeur général adjoint du centre médical Sheba et directeur par intérim de l'hôpital général de Sheba. Vous êtes aussi le doyen de l'école de médecine qui va ouvrir au sein de l'université Reichmann. Question pour commencer, on va revenir un peu en arrière. Est-ce que vous étiez prêt à l'hôpital Sheba à soigner, à recevoir tous ces blessés, tous ces anciens otages?
Well, unfortunately, I wasn't at Chiba at this moment, what we call now Black Saturday. I was in the. On va recommencer, s'il vous plaît.
Vous voulez
Okay.
que je...
Okay. Okay. I'll start again with the answer. Okay.
Yes, you can.
Unfortunately, I wasn't in Sheba at that moment or in Israel. I was supposed to give a lecture in New York. And I can tell you, it was one of the most terrible nights for me, moving around in my room, learning what's happening in Israel. We didn't understand at that time what was going on, but it was truly terrible. And I was fortunate that I took El Al to New York, so I could return quite quickly to Israel. Other people were stuck there abroad, and we were very, very worried. But apart from that, my people at the hospital reacted very, very well, and Sheba Medical Center received more than 100 wounded people just at this day. Some of them directly to the hospital. Others came from the hospitals at the south of Israel, which Barzilai and Soroka, which, by the way, behaved tremendously well with all the hundreds of wounded people that came to them.
Aujourd'hui, 5 mois après, l'enjeu principal pour vous, c'est la rééducation des blessés, des anciens otages. Et ça peut prendre des semaines, des mois.
Even more than that. Sheba Medical Center was founded by David Ben-Gurion, the founder of the State of Israel, together with Chaim Sheba, who was at that time the Surgeon General of the IDF, Israeli Defense Forces, and afterward the Director General of the Ministry of Health. By the way, I was the Director General as well, but many years afterwards. And what they did, they established the main hospital of Israel at the central part of Israel, in an army camp or hospital at that time that was created by the British and the Americans before the Battle of El Alamein. And they were afraid that Egypt will fall to the army of Rommel. Luckily, Montgomery won. So it was just used for, again, rehabilitation. So once they founded this hospital as a military hospital, they had a vision in their mind. They said people who will come wounded to the emergency room will come out rehabilitated and can return to the field to fight again. So we have the biggest rehabilitation hospital together with the acute care hospital, all of them together. So we are able to pass our victim people after we treat them very, very soon to the rehabilitation hospital. And because Israeli soldiers as well as civilians can choose where to do their rehabilitation, I can tell you that about 70% of all Israelis choose Sheba Medical Center to do their rééducation, as you said before.
Il y a un terme qu'on entend beaucoup depuis le 7 octobre, c'est le syndrome post-traumatique. C'est quelque chose qu'Israël avait déjà connu lors des guerres précédentes. Est-ce qu'aujourd'hui, il touche plus d'Israéliens? Est-ce qu'il est plus violent, entre guillemets?
Yes, it is. We learned that the effect of stress is quite important when we speak about us all, especially the people who were there. So what we treat them, we're not only treating their wounds, but also their, I would say, hearts and souls, and it's very important. We at Sheba, we have a very important center for treating post-trauma patients, and these people live there and work there, but we have a lot of experience. That's why we treat all the people. And we know that it's going to happen. We all, I think, it's not just the Israelis. I believe that all the Jewish world was suffering from PTSD, what happened there. We didn't think that such an event can occur again. I'm also the chairman of the National Advisory Board to the government of Israel on the on pathology and forensic medicine. And the work at the Forensic Medicine Institute after the war started and the massacre care was something that I will never forget in my life. Now it's already published, so I can share it with our audience. But there were, we just to give you an example, we received there something which looked like burn or charcoal, and when a CT scan was conducted, you can see a grown-up holding a child, and they are all being tied together with a tile by these murderous terrorists. It's something we never believed will occur, and that's why we are determined that these things will not repeat again.
Est-ce que vous avez vu des nouvelles pathologies se développer depuis le 7 octobre?
It's not something new that we didn't know before, but there are certain things that are changing in this war. First, the army, the medical corps, which I served for many years, was really advanced. So now, when people are wounded, they receive the best care within Gaza. So we have paramedics as well as physicians who are there with the forces, treating them, even giving them blood. And then we learned that the evacuation time from Gaza itself to the hospital is on the average 70 minutes. It's something unheard of in the world. So we receive very, very severe patients that before that unfortunately died, and we can treat them, and we give them the best treatment, and then we are starting their rehabilitation also within the acute care hospital.
Beaucoup de jeunes ont été blessés au festival Nova notamment. Comment vous les aidez? Vous disiez que vous traitiez aussi leur cœur, leur âme, au-delà des blessures, à envisager l'avenir aussi.
It's something that Israel will have to take care in the future. I'm not sure we understand the overall effect on these people. They will carry something with them throughout their lives. We'll have to do active treatment and to reach them out and to see, and also the people who lived in the kibbutzim around Gaza. So we are trying to embrace them, to hug them, to show them that we care for them, but we understand that their life will not be different. Some of the hostages came to Sheba. In fact, we received a very large number of them, and we know that because we continue to offer them our care, and we know that the only thing that will help them, apart from our support and mental as well as physical support, is their families. So you can see how their families come and hug them. Certain stories are heartbreaking. I mean, you can see people, children who were left orphans while their mothers and father were murdered, and their aunts and uncles now adopted them, and it's things that you see, you can only cry looking at them.
Vous vous êtes occupé de réformes sur la santé mentale. Est-ce que c'est un sujet sur lequel Israël avait renforcé sa politique avant le 7 octobre, depuis quelques années?
We did major changes also when I was Director General of the Ministry of Health, as I said before. We did a huge reform in mental health services. We passed them from the ministry to the treatment of the healthcare funds, the Israeli healthcare funds. But it's not enough. I can tell you that if there is a certain gap in the Israeli healthcare system, is the mental health services. We don't have enough. We don't have enough physicians, psychologists, and professionals, so we have to reinforce that. We understand that. So this year, the government has decided to put more money into mental health services. I think it's definitely necessary, but it will take time, because once you try to educate a healthcare professional, it's not something that's done very quickly. It's years and years and years of education and then gaining experience. So we will have a lot of work ahead of us.
Est-ce que la protection sociale, de façon générale, elle est suffisante pour les Israéliens concrètement? Aujourd'hui, les soins, les hospitalisations, est-ce que c'est pris en charge par l'État?
Well, money is never sufficient. If you speak but at the end, at the government level, they have to divide their resources between everyone. Our goal as hospital directors is to fight for our funds and that everyone would give us more money. We were partially successful. I wish we were more successful. We got some more money, especially for the mental health, as you mentioned before, but it's never enough. But we're doing our best. We are trying to make more resources available and to give the best treatment to the people. We understand that terrible things occurred on the 7th of October. The feeling of security of the people of Israel was shattered. We understand that people need to leave their homes at the south of Israel as well as in the north of Israel. There is an active fighting taking care there. I think that basically the people of Lebanon has nothing to do with it. It's the Hezbollah who's holding hostages the entire people of Lebanon, and we are trying to avoid fight. But we have to remember that we do not want the same thing that occurred in Gaza Strip to repeat itself in the north of Israel. And we knew, and it was published that there are certain tunnels that are going through the border. We have no dispute with the people of Lebanon. So we are trying to return the security both to the south and the north of Israel. The army it will need to be investigated how the army tremendously failed, by the way. Although the chief of staff of the army took responsibility, and I'm sure he'll resign after the war, after all the studies of what happened there, and also the head of the intelligence and the other people who failed tremendously. But we learned from that, and I'm very happy that the army took responsibility and improved. And now he's overcame the first shock, and now he's trying to bring security back to the north and to the south of Israel.
Une dernière question, vous allez ouvrir une école de médecine à l'université Reichman. Est-ce que vous encouragez les gens, les Israéliens, à se tourner vers ces métiers? Est-ce que l'enseignement de la médecine va être différent après ce 7 octobre?
First, we made it's a joint venture of Reichman University, which is Israel's only private university, together with the leading medical institutions in Israel. It's Clalit Healthcare Funds, Maccabi Healthcare Fund, and Sheba Medical Center, my hospital, which is ranked number 9 in the world, one of the leading hospitals in the world. Salpitre is part of this very honorable list. What we did is we prepared a whole new program. It's a 4-year program, which means that people who are being accepted are those who have BA in different subjects and did certain courses which are required. It's an American type of program. We submitted it to the approval of the Council of Higher Education. We did not get this approval yet, but we are hoping that it will be done very quickly because we are prepared to open this year. We need more physicians. We need more Israeli physicians. We need healthcare professionals, and I do hope that people who want will come and join us in Israel, make Aliyah and join us in Israel. Those who want to study as Israelis, of course, and meet the criteria will be able to study. Those who have other healthcare professionals, which is very, very important, will join us. At the end, apart from what happened, I'm a Zionist. I come from a Zionist family. By the way, my late father was born here in Paris. Unfortunately, his grandfather was taken to Auschwitz, and his name is now in the Marais, the memorial wall, and I have still a family here in Paris. But I do believe that people have the right to choose where to live, but I do promise them that although what happened, even in spite of what happened, I do believe that Israel should be strong and remain strong with a very good army and an excellent healthcare system, not just for us, also for the Jewish people throughout the world. And that's why I want to say to our audience that the fact that the Jewish people are with us, we don't take it for granted, and it's very, very important. At the end, Israel is there. But the entire world must understand that we are in the front line of a fighting between Iran and its allies against the rest of the world, against, by the way, Muslims as well in the more moderate countries. So Israel must win, not just for ourselves and for the Jewish people, but I think for all the free world.
Merci beaucoup, professeur Arnon Afek, directeur général adjoint du centre médical Shiba et directeur par intérim de l'hôpital général Shiba, d'avoir été notre invité sur RCJ.
Merci beaucoup aussi pour m'inviter à être avec vous. C'est très gentil.